for that is emotional well-being. Please feel free to stop me to ask any questions or just to discuss anything as we go along. We've carefully picked this topic and talk about things that relate to the over 50 Black men, mainly. So it should kind of be good for this audience this evening. Now, when we talk about mental health, next slide, please. There are conditions like stress, depression, and anxiety can affect mental health, which inadvertently could affect activities of daily living, our relationships, and physical health. So the main issues there, if you look at the stress, depression, and anxiety, because we're talking of this age group. So the number one is the stress, and that could lead to a depression and anxiety, or they could all just happen together. There's a situation we call acute stress situation, which you just find yourself in a situation that you're not familiar with, and you're trying to respond to that. And if you're not coping well, or you haven't got the mechanism to deal with it, this could lead to depression. And depression and anxiety, they are just one end of the other. They can overlap. And if these things are not addressed, they started affecting your daily livings, relationships, like I said, and physical health. So we need to strike a balance between our activities, our responsibilities, and we need to strive to achieve a psychological resilience to be strong to deal with day-to-day life issues. Now, mental health is a state of well-being in which an individual realizes his or her own abilities. You can cope, with normal stresses of life. You can work productively and able to make contributions to our community. WHO emphasizes needs to stay mentally well. So the first thing is avoid getting the active conditions. And if you are well, you need to keep looking after yourself and maintain ongoing wellness. It's so important that WHO get involved in this. Just before we go, we'll talk about this later on. So there are activities that keeps you mentally well. One of them is to have a very good social life, interactions, participating in games, like quizzes. Let's say we are here this evening and we're having a quiz game or tombola night and things like that. All those things are what WHO recommended to keep you mentally well. But we'll talk about that later on when it comes to the treatment. Next slide, please. In the developed world, it is estimated that 1 in 5 adults, we're talking of 20%, experiences mental health problems each year. Out of this number, about a quarter experiences severe psychological conditions. That is when it becomes clinical. That's a very big statistics. When you say 20%, you see 1 in 5. How many of us on this forum tonight? And more than 2 or 3 of us, we are having psychological issues. And among that, is saying a quarter, 4.5%, have serious mental health issues going on every year. So it's something that we should take very, very seriously. And it's a leading cause of disability. We're quite used to physical ailment, blood pressure, diabetes, things like that. When you talk about disability, mental health is quite disabling and is the leading cause in the developed world. The sad news, everyone is at risk. Everyone is at risk. Next step, please. Just 1 minute. Right. The risk factors, we talk about the social and financial means. I'll still elaborate on some of these particular points later on. So social and financial means, belonging to a marginalized or persecuted ethnic group can increase the risk of mental health disorder. Biological factors, lifestyle choices. We haven't got a female audience, but being a female increases risk of mental health status. We all have sisters, wives, colleagues So we have to recognize that these groups are quite more, predisposed to mental health problems. The female, so this is very important for us to be aware of, and hopefully we'll be able to understand what they're going through. Next, please. Now, so among the risk factors we're talking about, the socioeconomic conditions, like the kind of work we do or the work opportunities available to us, they are very, very important. Determine our mental health status. Housing, the kind of where we live, the environment, all these things, very important. The education, the kind of educations we are opportune to get are contributory factors. We can go more in depth to elaborate more, but if there's a question, please do ask. But we kind of know that people with the kind of job that there isn't any prospects, there's no good job satisfaction. There isn't good career. People are in a rut. You are doing a job because you need a paycheck, not because you really enjoy what you are doing. This can really affect somebody's mental health drastically. If people are being bullied at work, they're not being supported, they're not being trained. So we could sit here and talk about all these things that could go on at workplaces. The work that you wake up in the morning and you dread going in there because the environment is just not suitable. That can really lead to mental health. So that's very, very important. And, so things like that. Then the housing situation as well. If you live like 2 hours, 3 hours from where you work, you'll be surprised that some people commute that kind of journey to work. So housing, can you afford to live closer to where you work? Or the conditions, the environment, all those things, very, very important. So we pick it bit by bit, that the education available, the kind of schools available, the kind of training, the kind of skills you have could really affect someone's mental health. So yeah, then the next thing we talk about is the gender. So in fact, there are things we could change, that you have control over. Sorry, yeah. So this we use the word non-modifiable. There is nothing you can do about certain things like your age, your ethnicity. Those things affect your mental health. It could affect your mental health, and then gender. But these days, people could have sex change. So we probably shouldn't be there, but it's known that the gender, like we said, the females are more predisposed to mental health issues. The older you get, you are prone to have certain mental health issues. And then the ethnicity, the background, coming from, let's say people who migrate from one environment to the other, coming from one where they were and they move to another place. All those things could affect mental health issues. Especially what we call adjustment disorders. You're trying to live in a new environment and you do not understand how, the culture, how you just fit into the environment. You're trying to fit in. And in the process of going through all those stressful moments, trying to adjust to get they can really, really have impact on our mental well-being. The next one we talk about the biological factors, which is the genetic history. It can increase the likelihood of mental health, but not in isolation. When you look at the African tradition or something, they tend to, even the ancestral royal family in the English culture, they will look at the family background of people before you marry into that background. So let's say people have history of mental illness in the family, and you, from where you're coming, you have history of mental illness as well. You are increasing the chances that your offspring might develop mental illness. And it's a fact, it's been proven, but not in isolation. There are other stressors and environmental factors. When you have the tendency to have mental health, like I said, everyone is at risk. And you're now increasing, your likelihood is there. So you know what to do to prevent yourself from getting there. So that's what we talk about. So there are environmental factors that you could modify so that you do not express those things. It doesn't happen. But you get a warning sign anyway that, look, things are not right. You are in crisis. The body is breaking down. And then you need to find support and help. The physical illnesses, like cancer, people with diabetes, people with chronic pain, this can lead to mental health problems. Suddenly you wake up one day and my back is paining me every day. You're having pains and things like it will definitely have an impact on your mental health and whatever you do. People could have cancer. Suddenly, they just found out one day, oh, I've got this cancer, and that's, I might die from it. I might not have good treatment. Even the treatment of it and everything have impact on the mental health, and other chronic illnesses as well could affect our mental health and well-being. Next slide, please. Okay, I think I'm still okay. Yeah, right. We need to talk about common mental health disorder. We talked about stress earlier on. Stress, anxiety, and depression. So the main thing here is anxiety disorder is the most common type. So when we talk about mental health, I say years back, you think it's somebody who is obviously, you look at them and say this person is not well. But that's just nothing. That's a very small part, an insignificant part in mental health patients. The one you do not even see, you do not even know there's anything wrong with them. Those are the ones that's quite predominant. So anxiety is the most common type, and it's usually directed to an object or situations. Now, that's anxiety on its own, but there's what we call generalized anxiety disorder. This is disproportionate worry that disrupts everyday living. Sufferers may express physical symptoms of restlessness, fatigue, tense muscles, sleep disturbance, loss of appetite, weight loss. And there may be no trigger to this at all. So this is what we call generalized anxiety. So when we have an anxiety to certain objects or situations, they say, oh, this person has anxiety. If you have anxiety of doing these certain things or things like that. But when you have generalized anxiety, there's no trigger. They're just warrior. We use the word warrior. They worry about everything, and it's a very, very terrible situation. And they first probably go to the doctors. I'm tired. I'm tired every day. And you start doing all the blood tests. You do everything. I'm losing weight. You start looking for cancer. You check everything. My muscles, there's so much you do. And when you get to the bottom of it, you could not find anything physical. And then this idea, they don't even know they're having generalized anxiety disorder. And then you now broach it. I say, oh, okay, what's going on? Then it takes time. If somebody has suffered for like 2 years before, or a year, depending on the doctors they're seeing, before you arrive at the diagnosis of generalized anxiety disorder, which presents with a lot of physical ailments that are not there. And this is quite common. You'll be surprised. Very, very common. Next slide, please. Now, we talk about panic disorder. You could see their difference. The anxiety disorder, we've talked about that, generalized anxiety disorder, and then the panic disorder. They're quite close, but they're different. This one, irregular panic attacks, involves sudden overwhelming terror or a sense of imminent disaster or death. This is a bit common, and we have to be very, very careful. So if let's say you have a friend or a family member, or somebody that suffers from panic disorder, you have to be very, very careful what they say to you. This is them mentally, and they'll just come to you because they're overwhelmed. They just have panic about everything. So how you respond, how you manage the situation is very, very important, please. And it's quite common. So we go to phobias. It's very close. Phobias could be to an object, like insects, spider. They just have phobia. And you just run off rationalize that. Say, oh, you spider, come on, don't worry about it. Take it away. Please don't do that. Some people just cannot stand certain things. It could be marking on the wall. You go to some people's house, you have some dirt on the wall, and they become fixated. And that could be really, really, you can't understand it. That's nothing. No, it's something to some people. So you should be mindful of that. So it could be to something like and it could be social anxiety. Just in a social ground, you're being subjected to judgment of other people, and it could be personal, just personal. Like what is okay for A might not be okay for B. Some people might just like gathering. Some people just like to be in their own little corner and do nothing. So we should be mindful of this. So those are phobias. And then we have agoraphobia, which the general meaning is your fear of the open space. They just won't leave the house. They are just like in their house. The windows are shut, the blinds are shut. But that's misunderstood. It's a fear of situation you cannot get away from. Like you have to take a train to work, and this person will not get on the train, or using the elevator. So you just can't do that. They have phobia of that. That's agoraphobia. Next, please. Right. We have what we call OCD, obsessive compulsive disorder. The sufferer experiences constant stressful thoughts and a powerful urge to perform repetitive acts like hand washing. These people go to the toilet, they just wash their hands all the time. They are obsessed with cleanliness. The house will be clean, they will vacuum 10 times a day. It's quite common. I use the word common. These are the common mental health problems that goes around. So OCD is that. PTSD, which is post-traumatic stress disorder. This can occur after a person experiences or witnesses a deeply stressful or traumatic event. The person thinks that their life or other people's life are in danger. So you have to be mindful of this. So people are exposed to things that they shouldn't be seeing. Rape, violent attacks. You see people fighting. Like domestic violence. You see a child of 4, 3, 5 years old, seeing parents fighting. Terrible things like that. You can be quite traumatized with these things later on. That's PTSD, to name an example. Next, sir. Right, we have mood disorder. So you can see that we start from something that we think it's not, which is not really apparent. Then we're now going to things that could really manifest that people could spot. So we're going to mood disorder. The other thing for it is affective disorder or depressive disorder. You just see someone who is just withdrawn. They just look depressed. They look dead. Not really lively and things like that. So mood disorder is quite common as well. So when we talk about mood disorder, we go into bipolar. Bipolar is the extreme of two modes, which is manic, which is mania, period of elations, high energy. They just full of energy. I can do this, I can do that, I can be anything. And then to period of depression, it's crashing. They just crash down from that tower to a very, very low mode. When you see them, when they're manic, you just see the energy, you see the drive. The guy will come to you with an idea. I've got this, I want to do this, I want to set up this company, and you could see they have quite intelligent logic and something that is going to happen. And then the next thing you say, you disappear for 2 or 3 months. This person is in a low mode and in depressive state. It's very sad. And a lot of people suffer from this. High achievers, many great people are known to have bipolar to some extent, because it's one of those things you need to do crazy things. They're there, they're just not scared of anything. But when you get close to them, you'll see them when they're in their low state, which is the depressive phase. But you could have an isolated situation where it's just mania this person has. It's just driven. This person is driven throughout life. They're just elated throughout life. And it could be the other extreme, which is depressive state, and it's just chronically depressed. But yeah. And now we should mention another one, which is seasonal affective disorder, SAD, which affects predominantly a lot of people that move from the tropical region, the places close to the equator, and you move to the temperate. We move up north. We're coming to the temperate. So the vitamin D level has dropped. You're not seeing enough sunshine, and you just find that you're just depressed. And this affects a lot of people. It took years to get used to it. Seasonal affective disorder is very, very. So like all this, you can see how this affects our groups to some extent. So that's something to watch for. So seasonal affective disorder is mainly during the autumn, winter, and early part of spring, and that's when people manifest with these problems. And then once the summer is coming and another month comes out, and people are okay. Now, next, please. Right. So we go on to the one that we are all familiar with, that people have mental health, schizophrenia. Schizophrenia, it's not just one thing. There is a multitude of illnesses, mental health issues coming into one person. So it's not just, so it's not nice, it's terrible. So the age of onset is usually when people are teenagers, 16 to 20-ish, but some people could have a delayed expression of it till about their 30s. So you just need a stressor to bring it out. So once that thing, there's a tendency. It's usually there is talk that is genetic. In most cases, there's a genetic tendency. So, yeah, and it's very common in the Black and ethnic minority people. Although that's debatable, when they say it's common, it's just like the other race might have it, but they do not have enough stress for it to express in them. So they might just skip it and they'll be fine. But the Black, the ethnic minority, are faced with challenges of life, which can be very, very stressful. When it hits them about the age of 16, bang, and they express themselves. So it might be the first joint they try. You try the first cannabis, and they just go psychotic and become unwell and become mentally ill, start hallucinating and all that. Or it could just be going to university or starting A levels. The pressure of doing A levels is enough to trigger this mental health disorder. So, or they're leaving home for the first time. They might just get away with it through the A levels years, and the university, boom, this expresses itself. So it's horrible. Like I said, it's a combination of several mental illnesses. So symptoms, we talk about some of the symptoms. They use the word ranking. So there are positive and negative symptoms. There are other symptoms as well. The positive symptoms of schizophrenia that we say, yes, if somebody has this thing, then they have it. These include delusions, delusional thoughts, thought disorder, and hallucinations. It's predominantly auditory hallucinations. Someone is talking to them, he's saying something, and they hearing voices, thought disorders, and a lot of grandiose paranoia and delusional thoughts. They have the negative symptoms. That's when they have, you could see that's almost like mania we're talking about in the positive symptoms. Then they have the negative symptoms, which is withdrawal and lack of motivation. Not going to lectures, not involved in any activities and things like that. So those are the negative symptoms, and you could call that depression. You've seen elements of mania, you've seen depression coming into one person having schizophrenia. Sadly, there is no physical test or scan for diagnosis. It's a clinical diagnosis, and it's more of observations and taking a very, very good history to know what's going on. So you have to look for signs. So that's very, very important. So when you see someone who is withdrawing from their friends, families, and colleagues, always think beyond what's going on. There could be something going on. Usually mental health problems, So withdrawal from people is something we should watch out for. Avoiding activities that person normally enjoy. Let's say you go doing you play tennis together, you do things, and suddenly this person is just can't be bothered anymore. So clearly you should be alert that something is going on. Feeling hopeless. This person is always coming to you and just couldn't see anything good out of anything. You should just watch it. And consistently low energy, no drive at all. Or if you see someone who start drinking, substance misuse, taking alcohol, or start smoking, or nicotine, displaying negative symptoms like we earlier said, looking confused, not able to complete a task. You say, all right, please, can you do this? You give an assignment, and that person is just couldn't be bothered, hasn't got energy to complete it. You have to look for things there. Right. Thoughts or memories appearing regularly. They just have this. Some people use the word vision. You're saying vision. Be careful with who is seeing vision. If it's someone that that it's okay, fine. But if someone suddenly starts seeing visions and memories of things, you have to be careful and see if it's mental health. Thinking of, harming themselves, self-harm, or harming other people. Self-harm is so common, and people do not, because you don't know, you wouldn't even know that it's self-harm. And they usually do it in places that no one would see. Their thigh, their tummy, their arms, when they wear long sleeve clothes all the time to hide it. People are going through a lot of pain, and they self-harm themselves to release this pain. It's a sign of mental illness. So, but when it comes to someone just saying, okay, I'm going to kill, that's why threat, when someone is threatening somebody, I'll kill my wife, might kill my ex-wife or something like that, you take it seriously. It's a sign of something is not right. We've talked about hearing voices or experiencing delusional thoughts. Those things are. So you just pay attention to people. Now, treatment. it all looks, depressing when you hear all these things going on. So there are treatments. And the treatment, there's no generalized agreement on how you proceed to treat someone with mental health. So it's individualistic. So you look at the person and see because the patient's belief is very, very important. In the traditional African setting, you see people in a traditional mental health home where they, still manage to treat people with mental illness. Very, terrible way they manage to treat them. But it works, and that's why people go there. They kind of get the way to treat them to some extent. So, but here we have things like psychotherapy, because we've talked about things like anxiety, depression, and stresses. So the treatment for that goal is more of psychotherapy or talking therapies, to use the later. When you get people to express themselves, you have the Americans will use the word shrink. You just see someone, you pour out your mind, your worries, your troubles. You'll be surprised how they will arrive at a solution to the problem themselves when they've expressed themselves. So it's something that's very, very important. We do that not knowing every day. We talk to our friends, we pick the phone. Hey, how are you, boy? Something like that. More or less, you're offering that person psychotherapy. You are taking them away from their stresses. Like this forum we have now, like WHO, if we're interacting with each other, we're expressing ourselves. Let's say, like Annie said, we are going to talk about other issues rather than just ditching out stuff. Those things can be quite helpful and help our mental well-being. Things like quiz, engaging in games, tombola nights, all those things. They are raffle draws. They are quite things that are very good for our mental well-being and maintaining our mental well-being. Being happy is, the WHO aim is people should be happy. So things that will make people happy, like I said, quiz, games, activities are quite important. And you can see where I'm putting medications. Just very not significant. Medications is like, it helps the most important thing, which is the psychotherapy. When you're doing the psychotherapy, we do know that in certain situations, like depression, it's the lack of some vital hormones in the brain that is causing the problem. These hormones, we use the word serotonin, very, very important. We call it happy hormones. It's what makes people happy. They are released there are two parts of the brain. There's a frontal part, there's a back, the back part of the headache. So the brain is split into two. We have the frontal lobe, which it denotes our personality, and the occipital lobe, which is our intelligence, cognitive, and things like that. So when you release the hormone from the frontal, you release it from the front. The back needs to pick it up. It takes a fraction of a second for this hormone to travel from the front to the back. There's a little gap there. That fraction of a second is very, very important. If the back failed to pick that hormone, it failed to bind to that receptors, it's lost, it's gone, and they degrade quickly. This is one of the things that leads to depression. So that the serotonin get degraded quickly. Now, so what these tablets will do, the medication, part of the medication we do, which is the common one, is the serotonin reuptake inhibitors. So if once you release that serotonin, it would make them, it will give them, it will elongate their life. Instead of them degrading within a fraction of a second, you probably push it forward. So they are there, they are being hanging around longer than they're supposed to be, so that it gives the lazy part of the brain, the back part, to pick it up so that it utilizes it. And that's how this tablet works. So despite having psychotherapy, which is your own way of managing it, you still might need these tablets to help you to potentiate things. People hate tablets. I've had patients, and it takes me forever to convince them to take tablets. And one of the tricks I'll use is, look, you are not going to be on this tablet forever. It's just that dark moment when you are in a dark hole. The dark place is a horrible place. You just see any light at all. It's dark. And it's very dangerous. And that's where people kill themselves, suicide and all that. So you want to avoid such situations. So you please take this tablet. Once you are out of the hole, you are out in the dark, you can see the light, then you're all right. You have enough energy to carry on with your treatment. Now, I'll say when you are coming to the doctors, let's say you want to go to London now, you have two options. One is to use your car or train to get you there. And the other one is for you to say, I'm going to walk to London, I'm not going to use the train or car. You have the other option. Of course, you'll get to London eventually, but it's now how long will it take you? So please, the medicine, the medications, they are like your vehicle to getting treatment. And it's very important. And like I said, it's not for life, it's a short period of time. So we do need to use medication and take it, stop it once it's not needed. If it's needed again, we can always bring it back, just for a short time. Most people will be on it for 2 months up to 6 months. Mainly 6 months is recommended. And that's it for medication alongside psychotherapy or talking therapy. And there are things we could do, like self-helping ourselves, like changes to lifestyle, things we do. You drink too much alcohol, it doesn't help. It's not good for, I use the word too much. I didn't say don't drink alcohol. Too much alcohol is not good for our mental well-being. Not being active, it's not good for our mental health. Being active releases natural happy hormones, the endorphins. You do your exercises, you release endorphin. If you're doing exercises and you're not happy, I've not seen anyone doing exercises and crying, so it's you could see that. So once you're doing exercise, in fact, when you reach a certain peak, let's say you are the one that, someone that takes about 10,000 steps every day. Once you reach like that level, you will see all this natural burst of adrenaline, burst of happiness. They just release. These are natural chemicals that the body releases. Very, very important. So avoid alcohol, keep active, good nutrition, lovely food. You have, people, when you have lovely meal, you're happy, and that's, it releases some chemicals as well. Relaxation, very, very important. You can't, you say, oh, 24 hours is not enough. I have too much work to do. You are killing yourself. There is not too much work to do. So find time to relax. So I'm guilty of that too. So relaxation is very important. We have mindfulness. Mindfulness. It's be aware of how you chill out. How you kind of train your mind. To relax and engage in meditations. Meditation. And finally, I think we have what we call a support network. Support network. You need a team to function. I think that's very, very, very important. So the group of people that kind of know you very well, it's very important that you have those people that you can always talk to. Even if you're not talking to them, they could do something that's not right, and you find time to engage so that you could just distress. So support network is very, very important. And I'll talk about a useful website, like you can self-refer yourself. If you don't want to talk to anybody, just self-refer. These are professionals. They maintain confidentiality. You don't have to go to your GP. Just in the corner on your laptop, just go onto that website and self-refer yourself. There are forms to fill online. Next slide, please, Amy. Yes, so self-refer. So this is the northexciat.nhs.uk. This is for people that live in Essex. You can self-refer to that address, website, please, like that. And then we have the other one. The other one is mainly online based. You won't have any contact with anybody, but they give you signpost people to way to maintain good mental health. And it's me.silvercloudhealth.com sign up. So they just give you techniques of how to cope with anxiety, how to cope with daily stresses of life, dealing with all those things. Thank you very much for listening.
Yeah.
Hello.
Hello.
Okay.
Well.
Yes,
Yeah.
Annie.
Yeah.
Yes, I think.
Thank you. Thank you very, very much for that, as usual. And what I'll do now is I'm going to stop the recording so that we can actually have a confidential discussion and people can ask questions.